My name is Dr. Kenny Yong. I'm from Malaysia. I'm anesthetic by profession. I am a medical doctor trained in anesthesia, and I'm also trained in intensive care. I have been an intensivist for the past 4 to 5 years, and I work in the government hospital setting, and I'm already out into my own private practice, and I practice in multi-center right now, and I'm also into holistic balanced health practitioner, and I'm also practicing alternative therapy. The term HHA means Hypo Health Alert. It is a device. Hypo Health Alert is actually an alerting device that we use to assess the health situation called Hypo Health. Basically, it's a medical device that is connected to a PC or a computer that is able to act like an ECG detector. It's just like how an ECG detects cardiac activity. HHA is also a device to assess the health situation of 12 organ systems in our body. What is hypo health? Well, hypo health is a situation where you're not that healthy and you're not that sick. So we understand in the world there's about 5% people who are truly healthy, and they live in North Pole and South Pole. They are not here. And there's about 30% of people end up in the hospital already. It is because our body has reserve, and our body has a usable reserve. When our reserve is down to less than 30%, that's where we really get sick. And the gray area is before the 30%, before we really get sick. There is an area that is we call semi-health. That's what the word called hypo health. Hypo health means like you and I, we walk around, we're not that well, and we're not that sick either. When we go home, we don't feel good. When we go to hospital, the doctor disqualified us to be admitted to the hospital. And this is a time where, this is the area where, the hypo health area, is an area where we do blood tests and urine tests. Nothing much is wrong. Subjectively, we feel not good. And there's something wrong that we feel, but the doctor is not able to pick up anything. So this area is what we call hypo health. This is an area where our body reserve is being used up without our knowledge. And it is how disease eats us up in the early stage. We understand that our body will progress slowly from total wellness into total sickness. So most of the allopathic blood investigation and urine tests, we focus very much onto the extreme. It is in between this gray area. It's where the gray area that we do not have much research and also options into understanding more about the body compartments. So we understand our body is being made up of many, many trillions of cells. And the cell works together and teamwork together to form tissues. And multiple tissues would team up to work together as an organ. And in our body, many organs work together as a system. And when we have multiple systems work together, we have a human. So because our body is made to last really long, and our body is really difficult to be spoiled, to be destroyed. So our body is tough. Okay. So our body will only give big symptoms and manifest big diseases in a big way when our health situation is down to less than 30%. So God gave us great body, and 70% of it is reserve. And when disease eats us up, they eat our reserve first. They disturb our reserve. So when the reserve is being used, many of the blood tests and urine tests is not able to pick it up. Whereas HHA device is a perfect tool to be able to help us to focus not just on the traditional organ investigation, system investigation, and the body investigation, which we already very well known, very well versed into this kind of investigation. Whereas most of the doctors in the world, we have no way to understand how a tissue is functioning and how the cell is functioning. We don't have much options and much investigation into the cellular situation. We don't have investigation to review the real-time cellular activity and stresses, and we don't even have anything to document the tissue disturbances. It is almost like a cell trying to write a love letter or a complaint letter to the host to be able to tell them what is actually going on at the cellular level. These pieces of information are very important for a health practitioner, whether you are in allopathic practice or you're in alternative practice. Actually, HypoHealth Alert System is actually a device that has been widely used by astronauts in Russian space age technology many years ago. Before the Cold War ends, most of the space shuttle men they travel to space. There's no doctor to follow them, so they have to depend on this device. It's very difficult to do a urine test and also a blood test in the space station. So while they're working long projects in the space station, they depend on this device. It's basically a medical device that you can do a test onto a different various point onto your skin. So it is able to detect about 24 points on your skin, so that we can review the 12 organs real-time situation right at to the cellular level. So it is a very accurate tool that has been used by the astronauts, and they deploy the concept called telemedicine. You know, when you're astronaut in the space station, you do this test and you collect all the data into a computer device, and you beam this health situation device through this device. The health situation report will be beamed down to the Earth, and you know, the space station, the foundations on Earth, they are able to analyze everything, and they are able to come up with a solution and beam the information back up to the space station to review to the astronauts. That's how astronauts in space stations, they manage their health this way. And after the Cold War, this technology is not being lost, but widely being used by many hospitals and many centers in many countries, particularly 6 countries, for example, India, Russia, China, Hong Kong, Taiwan, Korea, and Japan. These are the 6 countries, and more than 100 over hospitals has been widely using this device. And this device has great benefits, such as it is a very accurate device, it is very speedy, and also it is straight to the cellular point. It is also convenient, and it is also a very economic health checkup system who have a real-time health situation. One more benefit of HypoHealth is that it could be easily mastered by someone who is interested in providing holistic health. And such a device has been widely used in pediatrics, geriatrics, and also in mental health institutes. In most of the mental health institutes, it is very limited to talk to the people who have mental health situations. So HHA is a perfect device to be able to detect what is actually going on in the body without asking much of the questions to the mentally ill. And in emergency rooms, where fast decision needs to be made, accurate opinions need to be obtained, many emergency room physicians in Hong Kong, in Taiwan, and China, they use this device to assess the real-time situation of the cellular problems and the tissue disturbances. HypoHealth Alert System report typically includes the report of the cell, the tissues, and the organs, and the systems, and the whole body. So it is a holistic coverage of symptoms, disease patterns, degenerative patterns, and also the total energy. Although it is like maybe 4 to 6 pages of a report, it is a very detailed report revealing the health situation of the total body, and the system, and also the organs, and also the tissues, and also the cell. We know all diseases happen when the cell is not happy. All big diseases or small diseases, they have a common root of the origin of the disease, which is at the cellular level. When we know how to remove the hindrances for the cell to recover, the cell will recover. HypoHealth Alert really zoom into the cellular situation, and it can help us to identify the problems that is stopping the cell from healing, and all those health situations that is blocking the cell communicating with each other. So when we remove all these hindrances, the cell will heal itself. So we can help a patient not just healing from outside in, but from inside out. Most of the big devices that we use in allopathic medicine, and also the common Western modern medicine world, most of the investigation focus on all those organs and systems and body. The big thing, whereas the micro things, we can use this Hypo Health Alert system. So Hypo Health Alert system is not a device that should replace the physician's opinion, but it can help supplement and also complement and also achieve a better goal. Is to be able to help the physician or a healthcare practitioner to look at diseases at multiple dimensions. So throughout practicing medicine in the ICU and also in alternative therapy, I found out that the real way of healing a person starts from the cell itself. Not just helping the self to satisfy the self, but to focus onto the cellular